Hi, my name's Allison Sharko, and I am going to talk about phantom pain and some current complementary and alternative medicine approaches used to treat it. So what is phantom pain? Phantom pain occurs after the amputation of a limb. Individuals will perceive sensation or discomfort in the area where their missing limb was located. So if your right arm was removed, then you will experience sensations and discomfort as if you still had your right arm. And it's usually described as knife-like, burning, squeezing, and throbbing. So between 50 to 90% of amputees experience phantom pain within the first few weeks of the amputation occurring. And the origin of this phenomena is still unclear. However, there is some research, and research suggests that the peripheral factor and central nervous system changes are involved. Research also suggests that there is a reorganization of the primary somatosensory cortex, and that there is a correlation between the extent of reorganization and the magnitude of phantom pain experienced. So it's assumed that the more reorganization that occurs, the more severe the pain is felt, the more pain you feel. Pretty much the only Western medicine approach to treating this is prescribing pain medications, and they haven't been shown to be as nearly effective as some complementary and alternative medicine practices. So one approach is acupuncture. Acupuncture is a traditional Chinese practice that involves inserting small needles and applying heat or electrical stimulation into precise parts of the body. For individuals experiencing phantom limb pain, the acupuncturist will often place the needle on the limb that was not amputated. So if the right arm was removed, needles would be placed into the left arm in areas where pain has been reported in the phantom limb. So if your right arm was removed and you're experiencing the sensation of having right hand pain, then the acupuncturist would put needles into your left hand where you say that pain is occurring. Research has shown this method of treatment to be highly effective, with people being free of pain up to 5 months or longer after an acupuncture session. Another method for phantom limb pain is biofeedback. It includes EMG biofeedback, skin temperature feedback, and muscle relaxation procedures. These techniques help reduce muscle tension and increase blood flow, which has been shown to decrease phantom limb pain. Research has shown this method of treatment to also be as highly effective as acupuncture. Two other known treatments are mirror box therapy and immersive virtual reality. So mirror box therapy came before immersive virtual reality, and it is a tool that allows a person with an amputation to view a reflection of an intact limb in the visual plane of the missing limb. This technique can trick the brain into believing the missing limb is actually moving. So they would place their hand into the box and then imagine that the reflection of their intact limb is the movement of their missing limb. Immersive virtual reality therapy was developed with the same goals as mirror box therapy, and as you can assume, it's pretty much a more advanced approach than the mirror box because it allows you to do a lot more complex tasks with your missing limb image. And the system detects the position and movement of the intact limb and virtually transfers the image to the space of the missing limb. The patient can then visualize on a screen the intact limb in the space of the missing limb. So immersive virtual reality allows more complete immersion into the illusion. However, mirror box therapy is more cost efficient. And here is an example of mirror box therapy.
Doctor of Physical Therapy, and this is the mirror box therapy that we have. For people with CRPS, RSD, after a stroke or amputation, that can be used in any number of with any number of injuries. So what we would start with is we'll take the involved hand and put it into the closed side of the box, and we'll take the non-involved hand and put it into the side where we would see the mirror, and then lean toward the side so that we could see both hands looking the same. And then we're going to visualize on that to start out with, so we might just concentrate on this for a period of time and then build from there to actually doing motions like pronation, supination, making a fist coming out, touching each digit, and slowly building up what we would do to including other things, even desensitization, where we might have some popcorn peanuts or something in the box and doing that, actually putting pressure on the bottom of the box and moving both at the same time. So you can see that it's important that you have a high quality mirror and that that we are building the things that we're doing. We wouldn't want to increase the symptoms, especially in CRPS. So that's a brief demonstration of what we do and what it is. Thanks.
Okay, and some questions are: 1, do you think phantom limb pain's high prevalence tells us something about the significance of perception? Is perception significant? Why or why not? So by this question, as we've learned, when the limb is removed, the perception is thrown off of if the limb is actually there or not. So what role do you think perception of having the limb plays in the pain that's experienced? Number 2, what other integrative health practices do you think could help those experiencing phantom limb? So we've learned about mindfulness, meditation, yoga, Tai Chi, all of those things that we've learned about this semester. Which one of them do you think could also be used to help people who experience phantom pain? And number 3, out of the 4 types of therapies discussed, which would you most likely use if for some unfortunate reason you had to use one of them? And then there are my references. Thank you.